we have to understand that alcohol is bad. So no limit of alcohol is what we call as a safe limit. So if you come to my outpatient department or my clinic and ask me, doctor, how much should I be drinking? My sincere and earnest advice will be nothing.
In today's episode, we are joined by Dr. Sumit Bhatia, Director of Gastroenterology and Hepatology at Paras Health, Gurgaon.
If you go onto the World Health Organization WHO website, it calls alcohol as a class 1 carcinogen, and no amount of alcohol is safe alcohol. Most of the Indian diets are deficient in protein, and if you are a vegetarian, the sources of protein become much more limited. So if you are taking whey to cover up that deficit, it's absolutely safe. Most of the young people I meet, they go to gym and they are given muscle bulking agents. So they are given anabolic steroids, which can have an adverse effect on your liver and which can have an adverse effect on a lot of other organ systems. So if you want to drink something good for your liver, the only thing which has shown to be of benefit is black coffee. I would like to emphasize that liver is your detoxifier. You don't take a chemical and try to detoxify a detoxifier.
Hello and welcome all to Big Idea, an exclusive series by Voice of Healthcare, where we bring you insightful conversation with change makers, thought leaders who are shaping the future of healthcare. In today's episode, we are joined by Dr. Sumit Bhatia, Director of Gastroenterology and Hepatology at Paras Health, Gurgaon. A leader whose expertise spans advanced endoscopic procedures, inflammatory bowel diseases, and cutting-edge therapies in digestive and liver care. Together, we will explore Dr. Bhatia's professional journey with groundbreaking advancements in transforming gastroenterology and hepatology. Welcome to our show, sir.
Thank you, Simran. Thank you for that kind introduction. And thank you for Voice of Health for inviting me and having me here. I'm so much looking forward to have this discussion with you.
Thank you so much, and so are we. So, just to start with, sir, to begin with, we would like to get into your journey. So, what inspired you to choose gastroenterology and hepatology as your specialty? And if we go beyond that, so what could be those defining moments in your career, if you could tell us about that?
So, before we choose gastroenterology or hepatology, we have to have a love for what we call as medicine. So when we are studying, when we are doing, so I always liked solving cases. The intrigue, the mystery around having a diagnosis. That's what is my passion is. So when you have that kind of a passion, generally you end up taking medicine as a subspecialty, and then further specialization. I think it's a field which chooses a doctor. So gastroenterology, hepatology, I felt at the time when I had to specialize was the most upcoming field. Most of my batchmates were very much interested in cardiology and neurology, but liver and gut was something which I felt was my calling. And during medicine training, we have those rotations amongst the different specialities for a month or 2 months. And I saw a visible, tangible difference in this field when you save a life of a bleeder who is bleeding profusely by using your endoscopes. When you, save a patient from liver failure by doing a timely transplant. Or you transform a life just by the right counseling in a patient of irritable bowel syndrome. So there were a lot of things which went in for choosing this specialty, and I'm so thankful that I made this choice.
Definitely, sir. And we can feel that satisfaction from your answer that whenever doctor counsels or you counsel and you treat your patient in a very right way and they become healthy and happy again. So the kind of satisfaction you get by seeing them.
That's I can say that's that's the most invaluable thing which we get back in medicine.
Definitely, sir. So as we are going forward, we all know that in the past 3 decades, healthcare has transformed in a very tremendous way. There's a lot of research advancements, AI, and everything has come up, and it is showing in the results. We have genomic studies, we have precision medicine out there, and everything. So if I have to ask, what are the most significant development you have seen in the diagnosis and treatment of digestive and liver diseases in the recent years?
So I think we can go on only on this question, and your episode will just linger on. But if I have to pinpoint in the last 2 to 3 decades, what I have seen with my own eyes and in my own career is the rapid advancements what we have achieved in endoscopic procedures. So from just being a diagnostic modality, wherein a video camera we were supposed to put inside the gut and have a look around, we have transformed endoscopy into what we call as an interventional space, wherein we can do a lot of therapeutic procedures. So, like I mentioned, the basic ones are to control an active bleeding. Okay. Now, with endoscopic advancements, what we are doing is to go inside and doing procedures which would have required a major surgery, like cutting out polyps or removing gastric tumors or colonic tumors, which hitherto or up till now were the domain of surgeons, that everything was only surgery. And now most of these procedures we can do by using endoscopic procedure. So there's a new field of what we call as a third space endoscopy, which has come up in the last 15 years in our country. And I'm very proud to say that India is at the forefront in advanced endoscopic procedure, especially in third space endoscopy, wherein we say that there are two spaces. So one is the gut cavity, which we call as peritoneum, and then there is the lumen, which we put in our endoscope. So we create a third space wherein we can go inside the layers of the gastrointestinal tract and then do procedures there, therapeutic procedures there, to release muscles or to remove tumors. And that's what is third space endoscopy. So that is one advancement which I have seen evolving in the last 15 years in front of my and during my training and career. The second will be in the space of procedures or modality called endoscopic ultrasound, which I'm an expert in. So EUS is the common parlance, wherein there is an ultrasound machine on the endoscope and we can do an endoscopic ultrasound. So this was a very, very cumbersome procedure just about 15 to 20 years back. And now we are doing so many procedures guided by EUS, which up till now were absolutely unimaginable. So we can take biopsies from the areas which were not possible till now, and we can do interventions. We can do biliary drainages. We can do certain very advanced procedures for the pancreatic tumors by using EUS. So the imaging, the endoscopic advancements have been tremendous. The second is in the therapeutic arena. So the lot of new therapies for diseases which are like chronic debilitating diseases, something like inflammatory bowel disease, the landscape of the treatment has completely changed. You would have heard about diseases called chronic hepatitis.
Yes.
So chronic hepatitis C and chronic hepatitis B. Till about 2 decades ago, in 1990s, when I was growing up, these diseases did not have a cure. And the therapies which were available were having a lot of side effects with not so much good outcomes. Just 10 years back, the treatment for hepatitis C, which came in the form of what we call as antiviral agents, the DAs, transformed the complete scenario. Now hepatitis C in today's world is a curable disease. Hepatitis B is such that we have such good antivirals that we can control the disease completely. Now, so all these therapies have come in last 20 years. IBD, the treatment initially was only steroids. And now we have at least 13 to 14 biological therapies which are available in our armamentarium, and we can treat these diseases very efficiently with providing significantly surgery-free life for our patients. So many diseases, we have seen the transformation happening. The advancements in liver transplantation. So earlier, end-stage liver disease or cirrhosis of liver was like a death sentence. So advanced liver disease, that means the patient is not going to survive. The transplantation has offered a ray of hope, and the successful programs running all across country in today's world have really transformed many a patient's lives. So I think the maximum advancements and the maximum developments in terms of every sphere you would see in gastroenterology and hepatology. I can go on and on if you want more on that, but these are some things which come immediately to my mind.
Definitely, sir. We would like to hear more and more of that from you. But we'll be shifting our gears to very common, thoughts we come up, our audience normally come up when we talk about a liver health or gastroenterology specifically. So, in everyday your practice you encounter you deal with lots of patient, and you may encounter lots and lots of myths and misconception. So if you could tell us few, and if not that, I have few in my minds, because I have come up across all those things, whether through social media or through just discussion. People say that drinking is not so bad if you drink in small amounts, so it won't affect your liver much. And if you're going to gym or something, don't try to take that powder wala whey protein. Just try to have normal protein, that is through egg, paneer or something, because later or sooner it may harm your liver. So all those kind of stuff, are they true, or any other myth you would like to burst today?
Okay, thank you for asking that. And it's a Pandora's box. So
Yeah.
if I can start opening it, so we'll not be able to cover everything, but let's just take 2 3 points which you raised. So first, on the very very controversial topic of alcohol. Okay, is alcohol. So alcohol is something which we have to understand, that alcohol is bad. So no limit of alcohol is what we call as a safe limit. So if you come to my outpatient department or my clinic and ask me, doctor, how much should I be drinking? My sincere and earnest advice will be nothing. So if you go onto the World Health Organization WHO website, it calls alcohol as a class 1 carcinogen, and no amount of alcohol is safe alcohol. Okay, now having said that, in liver diseases, so if you are taking say one drink say in 1 month or 2 months, are you at risk of liver disease? So I'll say no. So there are certain predefined amounts of alcohol which we say that predisposes you to have liver disease, if you are doing it for a prolonged period of time. But no amount of alcohol is safe, and the misconceptions about alcohol are aplenty. Okay, one, that red wine is very good for your health. No, it is not. It is like any other alcohol. Second, beer is not alcohol. Beer is alcohol. So we measure alcohol in terms of grams or the percentages. So if you are drinking beer, you are drinking approximately around 330 to 360 ml of beer in one go, and it's around 6% alcohol. But if you are taking a hard drink, you are taking around 30 ml or a 60 ml drink. So by percentage, 40% alcohol in whiskey and 6% alcohol in beer, but you are outsetting that percentage by having a large volume of beer. So having large volume of beer, though with a small amount of alcohol, will amount to the total amount of alcohol being high. Okay, so it will be as bad as taking a hard liquor. So there is nothing called as hard liquor, soft liquor, non-liquor. Second, very common misconception is on the quality of alcohol. You know that I'm taking a good brand, so I'll not fall sick. And the people who are taking maybe the cheaper brands will fall sick. Again, a very very big misconception. So alcohol is alcohol. Okay, whether you're taking wine, whether you're taking cheap wine or expensive wine, whether you're drinking a beer, you're drinking 3 beers in a go and thinking that you have avoided whiskey. No. So any amount of alcohol, bad. So if you have to drink, I would say bring it down to the bare minimum. In females, the tolerability and the metabolism of alcohol is not the same as males. So for females, the alcohol is a bigger threat for their fertility issues, carcinoma breast. So even a small drink, if consumed on a regular basis by a female, predisposes them for carcinoma breast. So it's a definite carcinogen. So alcohol in no amount is safe. Let that be the clear message. If you have to drink it, bring it down to the bare minimum, and be aware of the facts. Don't go by misconceptions that this is safe and beer is safe and whiskey is not. It doesn't work that way. The second question I think you asked about was
Whey
for
protein.
so the whey protein. Okay, so so we have to understand what is whey protein. So whey is a byproduct of milk. When paneer is being formed, the cottage cheese is extracted. The water which is left over, the whey protein is extracted from there. So it's a milk byproduct which is concentrated and then sold. So that is what the pure whey is. So whey is absolutely safe. Now, consumption of whey protein will not put you at any amount of risk. So if you have to match your protein requirement, which is approximately minimum for any healthy adult is around 1 grams per kg, it will go up to 2 grams per kg depending on what your targets are, but 1.5 to 1 gram per kg minimum we should be taking protein intake. Most of the Indian diets are deficient in protein, and if you are a vegetarian, the sources of protein become much more limited. So if you are taking weight to cover up that deficit, it's absolutely safe. It's not something which you should be worrying about. What you should be worrying about is when most of the young people I meet, they go to gym and they are given what we call as muscle bulking agents. So they are given anabolic steroids, which can have an adverse effect on your liver and which can have an adverse effect on a lot of other organ systems. So anabolic steroids will give you very fast and very quick results. Any obese individual can go to gym and generally they'll be offered what is called as fat burners. Yeah. So again, those tablets are very, very detrimental to health. So those are the gym supplements which we clearly say that please don't take them. So no anabolic steroids, no fat burners. But yes, if you are doing your workouts, you are having a normal, healthy, balanced diet, you can take whey as a supplement without any iota of doubt in your minds. Okay. There are certain more supplements which there are a lot of misconceptions, around that anything which is labeled as natural or anything which is labeled as herbal is safe and free from side effects. Now, nothing can be further from truth. So, we deal with a lot of drug-induced liver injury patients in our practice. So there is a big group of injuries which happen because of what we call as a CAM injuries. CAM is complementary and alternative medications. So people keep taking these medications, Ayurvedic medications or Ayurvedic preparations for which there is not enough literature available, and they take it thinking that this is very safe just because it is Ayurvedic or herbal. So medicine is a medicine. So unless and until it is prescribed by your own doctor, just don't assume that something herbal is safe or something Ayurvedic is safe, and stay away from all these supplements. Third, detoxifier. So I have seen another trend that we'll cook up a concoction and we'll take this concoction thinking that this will detoxify my liver. Now, I would like to emphasize that liver is your detoxifier. Liver is body's detoxifier. You don't take a chemical and try to detoxify a detoxifier. So have some mercy on your liver. So whatever we eat, any medicine you take, whatever you drink, everything has to get metabolized and it passes through liver. So it will have an effect on that. So you cannot detoxify your liver. The liver is there in your body to detoxify your body. Okay, so don't try to do its job. The liver knows its job very well and it will do it much better than what we can anticipate it to do. So just if you are taking normal, balanced, healthy diet, you are managing your proteins, not taking too much of fats, you are trying to avoid alcohol, you are doing your workouts, I think that's what is most important for your liver health. And don't take, medicines just because they are Ayurvedic or herbal and they are safe, and so-called, allopathic medicines, which I think is a big myth that allopathic medicines will have side effects. So no, we don't want to take that. So, all these are big myths.
So while you were mentioning about medicine, another thing came in my mind. While people say if you take too much of painkillers or any amount of painkiller, it directly harms your liver. So is it true?
That's true. So painkillers, you need to have a specific indication that why you want to take a painkiller. Now, if you are taking a painkiller on a regular basis, then the problem is the pain. So meet your physician, meet your doctor and try to address why that pain is coming again and again. But if you're taking a painkiller thinking that's not the treatment, that's only a symptom control. And yes, the painkillers come under a large group of what we call as non-steroidal anti-inflammatory drugs or NSAIDs. So NSAIDs can have liver toxicity if taken in large amounts. Once in a while you are taking it for a headache or any bony injuries or any sports injuries, it's absolutely fine. But people taking it on a chronic basis can have significant adverse effects both on the liver health, plus these drugs can also predispose you to have gastric ulcers and then urinary ulcers and have bleeding from those ulcers. So painkillers without any definitive indication is a big no. So as a gastroenterologist, we are not at all happy with painkillers in any sphere unless and until they are absolutely necessary for our use.
But thank you so much, sir, for busting all those myths and clearing the misconception
Yeah.
about all the pointers which you mentioned, because that was very necessary. As you know, we do not hear this from experts. We just hear from, that person, this person, and everything, and we start believing in all those things.
Absolutely.
So it's for our audience to start believing on what experts says rather
So
than surfing.
let me give you one extra
Yeah.
advice. Uh, so what is good for your liver? So one is the good lifestyle, the exercise, and everything. So if you want to drink something good for your liver, the only thing which has shown to be of benefit is black coffee.
Okay.
Okay, coffee without cream and sugar. So if you have a taste, even decaf if you take, you'll still get the benefits of coffee. So having 2 cups of black coffee in a day will do the trick for your liver. That's what, if you have to take a liver supplement, take only black coffee. Don't take alcohol. Don't take any other supplements. Don't take magnesiums. Don't take the other supplements which are very popular on our social media. I don't recommend those.
Now we know what is good and what is bad, what to take, what not to take for our liver health. So moving on, you have expertise on inflammatory bowel diseases also, and not everyone is aware what exactly is this, but slowly and gradually the cases are rising, but
Yes.
awareness is not there. If you could
Okay.
help us understand about it.
Thank you, Simran, for flagging that. So, inflammatory bowel disease, or IBD, as we commonly know. Okay. So this is, I think, something very new for our country. So the awareness has started rising along with the number of cases of IBD in India in the last 2 decades again. So what is IBD? So IBD, as the name suggests, inflammatory bowel disease. So inflammatory means inflammation. That means an unchecked swelling of the intestines, and it's a proper disease. So IBD is actually a group of diseases, and there are two major diseases in IBD gamut. So on one spectrum is what we call as an ulcerative colitis. So ulcerative colitis is ulcers in the colon. So generally the rectum, which is the last part of our large intestine, there are a lot of ulcerations which form from the rectal area, and it extends in a carpet-like manner in the large intestine. And the patients generally will have presentations with blood in their stools. Now, many a times this goes missed as a diagnosis, because many people assume that they are having bleeding from the so-called hemorrhoids or piles or fissures, and they don't seek medical help. So having mucus in stools, having blood in stools, having discomfort in your abdomen while passing stools, losing unnecessary weight are all the features of ulcerative colitis. So in case any of the person is having these symptoms, they should be immediately consulting their physician or gastroenterologist and to seek timely help. The second disease on the other side of the spectrum is what we call as Crohn's disease. So like ulcerative colitis was coming only in the large intestine and rectum, the Crohn's disease does not respect boundaries. So it can involve any part of our gastrointestinal tract, starting from mouth till our anus. So both large intestine and small intestines can get affected in variable amounts. So the the problem with Crohn's disease is that you get ulcerations in small intestine or large intestine with having intervening areas of normal mucosa. So you can have skip areas, you can have large areas of involvement of ulcerations and inflammation within the small bowel or large bowel. It can present as malabsorption. People can start losing weight, they can have unexplained abdominal pains, they can have diarrheas, unexplained anemias, loss of blood, loss of iron, generalized fatigue, lack of energy. So those are the common symptoms of Crohn's can be very aggressive at times, can have fistulas. You can have openings in the anal region or the perianal area from which pus is oozing out. Aggressive forms is called the perianal fistulizing disease. So these are the common symptoms, and surprisingly, we always believed the traditional teaching was that IBD is a disease of the West, and these diseases are not very common in our country. But what we have seen in last 2 decades with the country's development is that the numbers have been exponentially rising.
Yeah.
And the worst age groups which are affected by this disease are the younger age groups. The people who are in their second, third, fourth decades of their life, the most productive years of their life, they get affected by these diseases. It's both are chronic diseases, both are lifelong diseases. But fortunately, now since the awareness is rising, we are at tertiary centers being referred such patients very, very early on. And then if you pick them early on, we have very, very effective therapies to control these diseases. Both with basic traditional medicines and lot of advancements. You asked me about advancements. So the therapy landscape of IBD has changed in last 10 years. So now we have a lot of new drugs called biologicals, which and small molecules which are available for these diseases, and they are very, very effective in controlling such inflammation and giving quality of life back to our patients.
So you mentioned that it is happening to younger age group. Why is it so? Is it because of the lifestyle, the eating habits, or anything else is there to contribute?
So IBD is unchecked inflammation
Okay.
in the gut. Now, in our gut, when you are eating, very different varieties of food, and you would have heard that there is a big system in our gut which is called as gut microbiome.
Yeah.
So that's the our very own bacteria which have their home in our intestine, large intestine, and that is called as gut microbiome. Now, why IBD happens? Nobody has a very clear cut answer. I cannot give you one short answer that, this is the reason you don't do this and you will not have IBD. So there are multiple hypotheses or multiple theories of why it happens. So we say that, there are multiple environmental factors. Now, what environmental factors? We have seen that it was very common in Western countries which were industrialized and well developed. It was less common in developing countries. Now we are seeing the opposite. Our country is a developing country with the rapid industrialization which has happened over the past 3-4 decades. We have seen the number of diseases, more urbanization, more IBD. So one reason which is postulated is consumption of more ultra processed food. So that is considered to be one environmental risk factor. Rising pollution, smoking, alcohol, again risk factors. Can you do something in your diet which can prevent you completely from having IBD? There is a lot of research going on that. There are no definitive indicators as of now, but what we definitely know is having more ultra processed foods, having less of fruits and vegetables, having less of whole grains, having more refined and more ultra refined processed grains, again predisposes you in the long run for IBD. Having more emulsifiers, which are and more preservatives. So all these things which make your food very, very smooth, and the texture of food is improved by adding preservatives and emulsifiers. Some of these have been implicated. So in short, if you want to safeguard yourself, again, healthy lifestyle, more of natural foods, plenty of fresh fruits and vegetables in your diet, less of ultra processed foods, less of cokes, less of sodas, less of I would say chips, and less of candies and less of those preservatives. So environmental factors is one. Then there is a component which we say is an autoimmunity component, that your immune system gets activated. What are the triggers? There are certain genetic markers which have been identified. But again, these are not something which are there for the general population to be screened for as yet. So we don't have those biomarkers that, say, for example, if I want to get screened, that whether I'll develop IBD or not. So we are reaching that, sphere, but not as of now. The third is, so we discussed about environment, we discussed about this, and then there is something called as what we call as an environmental hit. Some of the infections have been implicated. But again, there is no one clear-cut answer why IBD happens. So it's a mix and play of autoimmunity, your gut microbiome, your environmental factors, the pollution, the industrialization of the society, everything put together.
So it's something which is new for us, for all our audience out there, because like I said, it is not being talked much about it.
No.
And the cases are rising.
Yes.
What about the food habits you said? So basically we have to avoid whatever we get from a cafeteria. And have to have home cooked food. So
more of natural foods,
Natural
more of and less of. So see, I would say that whatever we are eating, cooking in our kitchens, in our own kitchens, is also kind of processed, but
Definitely.
ultra processed. Everything which is like everything ready to eat meals. Try to have minimize those things. Try to have more of natural foods.
So try to avoid packed food.
as far as possible.
Exactly. So, but thank you so much for shedding light on that, sir, because like I said, it's not being much talked about, and we need more and more such kind of awareness out there. So, moving on to our fun segment, which is a rapid fire
Okay,
round, I will be asking few questions to you, and
please.
we have to make it fiery and bold. So, I would request if you can give me, some rapid and fiery answers to those questions.
Yeah, please.
So, one healthcare technology you believe will transform gastroenterology in the next decade?
So I will go with the popular answer, AI.
Okay. And if I have to ask how?
So AI is already, I think gastroenterology is at the forefront of utilizing AI in our practice. So when we do colonoscopies to identify polyps, which are like the pre-cancerous lesions, and the idea is to remove them so that they don't transform into cancers. So there are already softwares which have been inbuilt in our detection systems, which are AI based, which can detect even those polyps which a naked eye can miss. AI is also being very commonly used in image enhancement. So like, we can go in and see the images which were which are at the microscopic or pathological level just by click of our buttons, and the image storage and analysis. So I might be a very good endoscopist, but I cannot trust every other endoscopist who's doing it. Or if there is a very we need to have some kind of a standardizations between our findings. So AI is for image processing and getting to those diagnoses. AI is being very commonly being used. AI is also coming in early diagnosis in identifying those markers in diseases like IBD, in diseases like fatty liver diseases, the new markers, the new uptakes. AI is going to change our field, and it's going to be complementary to whatever we have learned so far. It's not in place of gastroenterologists. I don't think so that's going to happen. I think it's going to be the next big technology which is going to help us in shelving out more better care for our patients.
Definitely, sir. A mentor or moment that shaped your medical career?
I think my professor who trained me in gastroenterology is Professor Ganesh Pai. Um, he was instrumental in developing that sense of decoding and taking gastroenterology as a science, and not just taking it as any other just a procedure based branch. So I'm very thankful for the way he has taught me to think around a problem in gastroenterology, rather than just taking my scope and just jumping inside them. So I think that was a career defining, or I would say my whole thought process in changing my outlook towards gastroenterology.
Right, sir. And one quality you think every gastroenterologist must have?
I would say patient listening. So most of the gastroenterology problems arising from gut, the patients are distressed and they have a lot of misinformation and a lot of myths. I think a patient listener is a very good will become a very good gastroenterologist. Apart from the whatever the skills we are required to have as an endoscopist, and whatever knowledge we need to have as a therapy person, but I think a patient listener. But I think that goes on for every doctor, not only a gastroenterologist, but yes, a patient listener.
You rightly said, sir. And one favorite part of yours while interacting with patient?
So I still get a lot of pleasure, you know, after I do a difficult endoscopic procedure. Okay, and that instant relief which you can give to a patient by stopping a blood vessel which is bleeding, or stenting an obstructed bile duct, and you see that pus flows out and the patient gets better within the next few hours. That's something which I love. And then having that connect with your patients when they are coming with not so what we call as a definite medical problem, but functional problems of something like irritable bowel, and then understanding and getting to connect with them and trying to explain it to them that these things will get better along with some minor modifications. So those are some things I really still enjoy in my practice, and I think I'll continue to do that.
That's great, sir. One daily habit that keeps you focused and balanced.
Reading. So if you ask me, one thing which has helped me throughout has been to read, and it's not only the textbooks. Now I think in today's world, the consumption of knowledge comes from all spheres. So I read. I read on my mobile most of the times now. I read on my tablet. I read on my laptop. I read the newspapers. I read a lot of fiction, non-fiction books, and I definitely read some of the scientific journals to just keep myself updated. But I think that is one habit which I think has helped me throughout.
It's the last movie or show you enjoyed
And there are
watching.
multiple movies and shows. So I am a big fan of thriller genre.
Okay.
So the last one I watched was Department Q and The Residence, and both were just outstanding. They were very good. The last movie I think was F1. I really loved that one.
That's a great one. So, a medical or life mantra you live by.
I think take one day at a time.
Hmm.
Enjoy that day to the fullest. So the day which starts will end, howsoever busy or difficult that may be. So one day at a time.
That is very right, sir. Take one day at a time and don't think much about your future, what is happening and what is
Right.
not. So with this, we have come to end of our discussion. But before you go, I have another last question. You have decades of experience in medical health as gastroenterology and hepatologist. But one career advice you would like to give to the professional, those who are just starting or thinking of starting their career in medical health, you would like to give.
So so if I have to tell my younger colleagues, I think this is a fabulous field. If somebody wants to come into this and choose it as their vocation, um, it's the field wherein the most academic advancements are happening, and this is the field where most of the technological advancements are happening. This is the field where you can have best of both worlds. So like if you had some kind of a cringe in your heart that you know that you are not a surgeon, I think you can have best of both worlds of surgery and medicine in gastroenterology. So I think this is the best time to become a gastroenterologist. So enjoy your journey, and this is the field to look out for.
Thank you so much for those words, sir.
Thank you, Simran. Thank you for having me here.
Thank you so much, and we really enjoyed this conversation. I believe our audience would have definitely enjoyed and learned
I
many
hope so.
things. Yeah, definitely. Many
Right,
things
thank
out
you.
of this conversation, because this was purely focusing on Dr. Bhatia's journey and some myths, misconception about the liver health of ours. So thank you so much for sharing those
Thank you,
insights,
Simran.
sir.
Thank
It
you.
means a lot, and
Thank
thank
you.
you so much.
Thank you.
Cut.